Шановні колеги, доброго дня. Український медіа-центр реформ розпочинає свою роботу. І сьогодні ми говоритимемо про реформу сфери охорони здоров'я. «Реформуйся або помри» – так називається брифінг, під час якого фактично буде висловлена консолідуюча позиція як експертного середовища, так і Міністерства охорони здоров'я. Прошу до слова, шановні спікери.
Good morning, esteemed colleagues. Thank you very much for an opportunity given to me to communicate with you today and to talk about the different stages of reform, the need for reform, and the vision of the Minister of Health, how to, where we have to go to. And today, perhaps they are going to vote in Colorado for the package of the draft laws associated with one of the elements of the health care, but very important element or component without which we cannot make progress. Very often those draft laws, whether intentional or not, are, let's say, considered as the whole reform of the healthcare as a whole. Now, of course, it is not this way, it's just part of the reform. In any case, in the modern world, in the modern geopolitical conditions, the system of healthcare in different countries are being reformed or further improved, actually on a continuous basis, because new challenges or threats, migration processes, and new infections, new diseases. Actually, we have the IDPs and migrants throughout Europe from the areas of conflict. That's why the system has to be permanently reformed. To say that in Ukraine we are going to start reform today till some period of time in the future is not the correct thing to do, but we understand that those are going to be continuous changes in the reforms, but their direction depends on the first steps. That's why Minister of Health, together with our partners, first of all, international organizations, also national experts, we have developed, have drafted in the whole package, the whole strategy. For a certain period of time we did that, which is in near future going to be finalized, and some of its components to some extent have been already implemented. Why it's important to talk about the model? And why it's important to talk about the new model of financing the healthcare system? It's important to talk about that for the simple reason that those limited funds or resources allocated by the government from the national or public budget, only 3% for the healthcare is not absolutely, this sum of money is absolutely inefficiently consumed or spent and doesn't bring to high quality indicators in the system of healthcare. We know where goes the lion's share of those 75–80% of this money means the salaries, some communal services, and upkeep of our preservation of our facilities. And we cannot even talk about the quality of the medical assistance or to, let's say, to fight the death rate. According to our calculations, out of the money allocated from the state budget in the form of subventions to the regions, only 9% is spent for providing services. The rest is for the upkeep of the infrastructure. So the question is, the infrastructure per se can ensure the healthcare system efficiency? No, but we do not have money enough. Where we could take the additional reserves, or we understand we have nowhere to nothing to take it through. We have to understand how to more efficiently use the available resources, how to the resources which we spend for the infrastructure could be channeled to ensure the services given to the patients. That's why the autonomy of the budgetary institutions which consume this resource has to create, first of all, such conditions that the money available can be most efficiently used. We have to create the prerequisites for the competition between the public establishments, not the privatized one, but the public, so that we could understand that this is no longer this spending, not spending with budgetary funds. Those are the funds which are state allocated or contracted in order to provide this service and to render service, and this service has to be provided at a very high level of quality and result in improvement of the condition of health. We have to understand without optimization and efficient use of resources, we won't be able to start the balance of the system. We cannot plan our next steps in order to increase the quality in specifying the priorities in our country. I repeat myself, when they say this is not reform, no, it is not a reform. This is not a medical matter. This is a business economic model which has to be further perfected or improved. Otherwise, we are going to collapse. They say no, there is no money coming in this. We say, okay, allow us to have autonomy. No, we cannot do that. Don't give us money. We have no money. Then autonomy. It's this kind of evil circle. And of course, maybe some other people will come to replace us better and more professional. But nobody can start from the autonomy. Nobody said no to that in the post-Soviet space. Only Ukraine and Azerbaijan. All the Eastern European countries, Central European countries, they went through those models. Yes, they did a lot of mistakes with the decentralization, but later on about that, we have to ensure the element which had to be implemented, whether this self-assuring element. No, you can see in this slide our colleagues from the RPR helped me to prepare that the National Council reforms, thanks to them. This direction of the autonomy of the institutions can be balanced by the fixed price of cost of medical services, which is going to be considered now, and we are going to prepare that in the near future. It's important to have it so that everybody has, all the institutions have this list of the services to be provided, the same list, I mean. Then based on that, we have to provide the guaranteed list of the medical services. It doesn't mean that we are going to guarantee anything to our citizens, and all the rest will have to be paid by them from their pocket. No, we can say that something will entail some additional payment. For example, the TB, HIV, and AIDS can be 100% guaranteed by the state. And then another element which is mandatory in this configuration, autonomous establishment, the guaranteed package, the public money, because we have the only customer, the public customer. Our foreign partners are tired to repeat. You pay for your services yourselves. The fragmentation of the control is too complicated. The national, regional, district now could be on the level of communities. But when the state can actually purchase the service for well understood price and the package, not the private, we're talking about the public, maybe the private as well, if they will be interested to sell the private, the public services. We'll have all this will be mutual beneficial. And the money we're going to have not for the upkeep of the building, but for my house. Then potentially we are going to have more, let's say, more demand. We are not talking about the governmental money, but the different requests and demand. If you are talking that there will be no more the budgetary mentioned, it's not true. We are going to change our attitude to spend this budget, not based on the Soviet principle, how much you need, you have it and do whatever you wish. We are going to do something to increase or to improve our services. When we need some service, we do not For example, we used to buy candies in the Soviet times to give me candies for 2 rubles, whatever the weight would be. We now say I need this commodity or good, and I am prepared to pay for that such as this sum of money. So the same here, I'm prepared to pay to pay for the services such as this amount of money who can provide me the service I need. Okay, now I have a letter from one of the municipalities of Ukraine. And the mayor of the city addresses the Minister of Health for the 3rd time that he doesn't have enough money, about 16 million hryvnia. You know, they need the money to pay out the salaries. Again, we are talking about paying the salaries, not to providing the services. And those, you know, who come from big cities, you know the situation. They also have the huge regional hospital or railroad hospital, a huge one as well. So maybe it would be cheaper to buy the services of those hospitals, but he cannot do that because he has to provide money for the municipal hospital, and maybe he will go to the John Stock Company locally, and me, myself, as a citizen of the city, I will go to the railroad hospital, to the regional hospital, whatever. Maybe I won't be provided services, and I will not have the services I need. So the question is, again, not the healthcare system, the management, efficient management of our own resources, which have to be efficient for the population. We are talking about high quality medical services. The buyer, the purchaser, this is a very important thing. We have to use more business tools which are available according to our plans, which are logically stem from the development of the events. This agency can be organized in 2017, provided the year 2016 will take care of the necessary measures. And the money from the patients, this is the payment for the services, not for the infrastructure, for the services, which will include the list of the costs and the payments, which will actually buy the services, not the establishment. And despite the different discussions which take place, whether it's high quality or poor quality, we say today that it's not really realistic to implement this plan of ours in 2017. Maybe more chances in 2018. We spend a lot of time for implementation of those tasks. We know that our plans have been submitted, something like in June. They took a long time to discuss those. They came out with different alternatives. They still are doing that. The problem is not associated with alternatives, but the problem is that the year 2018 can turn into 2019 or 20 or something like that.
Well, about the draft laws, I've already mentioned that all the alternative draft laws create preconditions, economically efficient, financially efficient preconditions for delivery of healthcare services. It is not about the quality of service. It is not about the amount of service. Here we're thinking about the adequacy of services. Currently, this is this situation. We have subventions which are calculated per person or per beds in the inpatient hospitals. So we calculate per person, then allocate this money to the region. Well, then the region tries to split this money between the beds in the hospitals, and they suggest that we have to change the status of the of those clinics and hospitals, then we have to allow them to be autonomous. Then they will offer some services, and in line with those services we have to allocate money. There are no options to this general scheme. If we try to cut down the amounts of personnel which now exist in the clinics and hospitals, this won't result in cutting the beds, cutting numbers of beds. Also, non-profitable clinics which calculate their expenses in beds, then inefficient managers, accounts existing only in the state treasury. All this hinders delivery of the services, efficient services. We need to have efficient managers, we need to have the list of offered services, we need to have the supervisory board which will supervise how those healthcare institutions functions. So these are all necessary steps. Then about beds in the hospitals. Each region has to decide independently what is the specificity of the region, what beds, inpatient beds they need. For example, some of them maybe need a HIV clinic, some of them may need tuberculosis beds, so this should be substantiated somehow. Now on your slide, speaking about decentralization and how it is related to the healthcare. Unfortunately, the Parliamentary Committee on Decentralization does not communicate with us, and if we do not focus our attention on decentralized healthcare services, they may result in huge disaster. If we do not do this process of pooling this year at the regional level and simply allocate money to the regions for the healthcare services, then this will result in total wasting of the money. The next issue about tax vacations for healthcare institutions. If some healthcare institutions after reforming appear to be financially, commercially inefficient, this might raise the issue about reinvestment of money, but not imposing additional taxation on them. Actually, we have prepared all our suggestions which I described and included them to the draft laws which were submitted to the Parliament, and there is urgent need in discussion and passage of these draft laws in the Parliament. As I already mentioned, there are only two countries in post-Soviet space, Ukraine and Azerbaijan, which allocate money for hospital beds, not for healthcare services, while Azerbaijan has its state reserves, state currency reserves coming from oil dollars. Ukraine does not have this resource, but instead we have huge expectations of Ukrainians on improved healthcare services. I believe that each postponement in and delay in review and passage of the law for the quarter postpones the actual reforming of the sphere 1 year, and at this moment, when we try to include the draft laws into the parliamentary agenda, we understand that if they are not passed very soon, they will be postponed till maybe next year. When we communicate with the MPs directly, or when we communicate with the regional health and local healthcare institutions, they are absolutely they absolutely agree with reforming. That this shows that explanations without politics.
Clarification. If you're talking about draft laws, they have been registered in Verkhovna Rada. We are prepared any day to submit them to the MPs and supporting that with the strategy and the plan of actions in each specific direction. Our strategy, including the changes in the financing system, we are already prepared, but there is no. We don't know when this can happen. The committee actually responded in the negative regarding the quality of the draft laws, though the chief scientific and expert direction, they gave the positive conclusions. Our actual draft laws are being registered in the Verkhovna Rada. We can defend those anytime. Okay, thank you. And the next speakers, please. Good morning. Chernenko Zoryana, expert of the Reanimations Package of Reform. We have not enough time, but the second speaker's task was to briefly explain the experience we amassed during different pilot projects and the experience we amassed, because whatever is proposed today, we have a lack of arguments and we do not always perceive the international experience. We have some experience working over a pilot project, but we do not have enough laconic or brief analysis in two regions which were more successful in implementing the pilot project in Dnipropetrovsk. It's clear that we cannot have the result from the Donetsk region. Speaking about Kyiv, since in Kyiv they started to introduce, they missed a lot of time before start to implement that. They cannot have interesting results so yet. Those projects were simple. We are talking about the increasing down the accessibility, improving the quality, which is a matter of complaints, and to increase the efficiency of using the budget. For 15 years, we have mentioned that in all the regulatory documents. Speaking about the pilot project, the key component was to separate the family physicians from the experts. We did that in a very strict manner, and actually it was forbidden to see the specialists without the first consultation with the family doctor. Okay, we had to take care of the good finance, and we also allocated some additional extra funds for new laboratories and equipment, which could have to provide a very good start for the primary health care. But we didn't finish that task, or the logistics and the routing of patients, where how he can have an approach to the experts, to the specialists. We did not take good care of this kind of transition between the primary and secondary health care. We also restructured we changed the communal, established it into the non-communal. In each region they have their specific features. For example, it means that we are set up training centers which took care about the training of high-quality family doctors, which were lacking a lot. And in Dnipropetrovsk, because of the very acute response of the public, They organized the media center, which provided all the citizens with the possibility to get the information what's going on in the region, what kind of pilot project we have, and what result we achieved. So if we are going to talk about certain changes efficiently introduced, there is quite a few not bad results or outcomes. Also, a compulsory component which we had in our pilot projects was the increase of salaries. Nowadays, family doctors, but however, it turned out so happened that we almost doubled the salary, but we did not have some kind of interrelation between the improvement of the quality and the increase of the salary. In other words, this didn't have any effect on the desire to increase the efficiency of the treatment. If we are talking about the formation, the price formation, that depended on some results like increasing number of the visits to the family doctor. Again, we face here a critical situation, a critical picture. For example, in the Dnipropetrovsk region, where there is a lot of IDPs today, who have not been registered, and they are not taken into consideration if we are talking about the load on the this specific family doctor. If we are talking about according to the standards, he has more than enough patients. I mean, his load is much higher than it's regulated. When according to the regulation, makes provision that actually we had a secondary visit or second visit, you are going to be fined, because that means that during the first visit you didn't take good care of the patient. In the Kyiv region, we had some changes as well. The association or union of the doctors or the hospitals, when they realized that they had not enough patients in the hospital, they kind of united, which had a very positive effect on the quality. It was done not always taking into consideration the decision of the communities, which we are talking a lot today. We had in some places we had some conflicts, but today for the comprehensive solution, it's a good thing. Also, we take care of the high-level computerization, but they did not launch not the software, not training. Again, we inefficiently spend the money because we did not show the results regarding this component within the framework of our pilot project. Again, speaking about the experience of the first attempts, there is a very good team which works in the region for communication and the preparation and the financial calculation, etc. Mandatory communication campaign, because the population does not understand all the transformation changes, organizational training centers, because today we do not provide for the required number of family doctors, uniting between different hospitals, owing to good infrastructure, transfer infrastructure, and what doesn't work, just increase the salaries within our centrification and the system of maintaining the hospitals doesn't work, or the systemic computerization also neither works. We have those regions where you are interested to have some positive changes in their region and to improve the medical services provided. Number two, not always decentralized decisions, taking into consideration the requirements of the communities. Increasing the number of the communities actually population allows us to implement something without the human factor being considered. There was no. That's why I believe that we are going to increase increase the number of the pilot projects in different regions. It demonstrates that this could be efficient.
Добрый день.
Good afternoon. I'm Anatoliy Holunov, Director at the Center of Computing, Social and Medical Technologies. During last decade, after a shift of Ukrainian healthcare system into into allocation of state funds for healthcare depending on per capita basis resulted in a situation that money allocated per capita, but they do not reach physical persons. In Kherson, Mykolaiv, Odessa, Lviv, Crimea, Donetsk, and Mykolaiv, the pilot project was launched. The key element of reforming any managerial system is to reach optimal ratio between expenses and quality of services, so this was our major objective. The most effective was Voznesensky district in Mykolaiv Oblast, because they managed to shape a very productive team chaired by mayor, local MPs, and they invited good professional physicians, and they reached rather good results. First, they broadly developed the family medicine ambulances, and they developed also a powerful computer system able to analyze data about services, medicines, etc., and this allowed to manage efficiently expenses and results. They also used the clinical protocols, and allocation of money was based on the use of these protocols. They provided extensive training for family doctors and in the use of computers for special medical services. It was very important to allow free access to family doctors for patients, and that's why they drafted contracts between family doctors and patients, and in that contract it was fixed that all the patients take moral commitment to follow recommendations of family doctors and make efforts to restore their health and take preventive measures. And immediately after establishing this system of family doctors, many patients changed their family doctors, and all the contracts signed between patients and doctors, they were related to this change. Also, there was one important aspect. We explained to healthcare personnel that only actual need in medical services shall define the amount of medical personnel needed for employment. Also, from organizational point of view, local activists, mayor, local MPs, and chief manager of the region, chief medical manager, they organized special sessions and discussed organizational and managerial issues. At the same time, once a month, special medical council provided analysis how many times per month emergency ambulance was called to the patients with chronic diseases, and what was the reason for this emergency call. Of course, nobody prohibited neither dispensarization or additional calls to doctors. One of the key elements is as follows. In result of all these changes, we managed to shift to real per capita allocation of money and per capita delivery of services. This allows to reallocate resources between hospitals and or inpatient hospitals and outpatient clinics. For example, there is a problem with TB and hyper pressure, and the district powers decides to reveal the TB patients and and patients with high vascular pressure and to improve healthcare services to them, and thus the additional money were paid to family doctors who stimulated their patients and in result of the situation in healthcare with all those diseases improved, and number of inpatient clinic beds was cut down considerably. This shows that money could be reallocated and follow the real needs of patients. And I would like to emphasize once again that the patients themselves do not feel any inconveniences related to the change of the system. In the inpatient hospital, when they founded the primary health care services, they immediately revealed that they had the redundancy of personnel, and for example, instead of 8 pediatrists, they needed just 2 of them, and in this situation they offered special retraining course to those doctors, and those retrained doctors who had experience in another medical specialty, after retraining worked even more efficiently than just newly produced family doctors, and this allowed to refresh the membership of doctors in the district.
Yeah, she'll tell them the results of our work. We drastically decreased the number of the ambulances. The number of deaths as let's say of the myocardial infarction or the stroke. I remember in one of the districts there was a lot of TB cases. The primary revealing the number of the patients, and then the work of the family doctors allowed to achieve the better dynamics of those indicators. Next one. In 2010-2011, there was in the USAID project being implemented, which actually had to evaluate the models of medical care in different regions of Ukraine. So Voznesensk was part of that project. And according to the USAID project data, 72% of all the medical services provided in this region were rendered by the family doctors. In fact, they completely control the situation. Also, the polling results show that 63% of the population support those reforms or transition to the family medicine. Next slide, please. Speaking about this is the last slide regarding the negative results. What actually then the most important negative result is system conflict. Why? Because there was a kind of black sheep which actually didn't want to do anything. So they say, what do you want to do? Wait until there are some guidelines coming from the top. If there are no guidelines or instructions, just sit down and wait for something. Why should we actually, let's say, deteriorate our indicators, etc.? But we are blessed that somebody took care of that boss. We had a new governor, a new chief of the directorate. Then impossibility to pay the doctors according to the results of their work. There was such situation when we were talking about some extra payment for the services for the end result. Actually, doctors could make up to 7,000 hryvnia. Of course, in the budgetary model, nobody could pay that sum of money to them. In the end, I would like to say there is a ready model. There is a tried mechanism of management of the costs of medical services, the calculation of guaranteed level of medical services. But today, everything is suspended for one simple reason. There is no legal basis which this model could be based on. That's why the governor of the Nikolaev and Kherson regions wrote a letter to the Minister of Health with a request, if the Verkhovna Rada does not adopt this law, give us some kind of status so we could continue to work further to develop this system. Thank you. Good morning, dear colleagues. My name is Oleksandr Yabchanka. I'm manager of the Healthcare System Reform Group, RPR, Reanimations Package of Reforms. I would like to say that we carried out a very serious analytical work how to improve the quality of work of the public and communal healthcare institutions. And that we realized that the centralized management, first off, is not efficient, and correspondingly the system does not work. So the planned system of healthcare, kind of the inheritance of the Semachko system, does not work. I'm very much pressed in time, so the key thesis contained in this study, number one, money come after the patient. So it is patients and not officials have to distribute the budgetary money and budgetary funds, and the patient has the right to choose the doctor, and the patient is going to choose what kind of hospital, what doctor will receive the money from the budget. Number two, communities have to manage the hospitals. According to this decentralization, responsibility for health care is going to be given to the level of communities, but there is no mechanism which the communities could use and actually exercise their right to property. There is no such mechanism, and this mechanism has to this mechanism should be provided for the package of draft law on the healthcare system. What I would like to say, I would like to address the deputies of the Verkhovna Rada, MPs. The matter is actually the draft laws were registered on July the 7th. Now we are living in the end of November, so I would like to call upon MPs without any delay to vote for the respective changes or amendments to be introduced into the effective legislation. I would like to approach the cabinet ministers in case the Verkhovna Rada fails to adopt the much required transformations. The cabinet ministers have the authority to provide the regions the right to determine the national medical system themselves. So we call upon the government, we call upon the Verkhovna Rada of Ukraine to come to a consolidated decision and to immediately start reforming the existing healthcare system. Thank you. Thank you. Are there any comments or questions? I have questions of the following nature. I would like to ask the speakers to get to the podium. The matter is that the example was Sensk. You know, it has been cited for a long time now in 2010, 11, 12, etc., etc. So the authorities were changing, but we do not have a lot of positive examples. So I would like to ask you, are there any kind of other examples similar to the successful story of Voznesensk? Was there any political will of the local authorities? I believe there was only one hospital there, right? So the small scale of this reform allowed you to achieve some result. With your permission, I'm going to tell the story of actual studying this issue.
We do not have a time for this story. We tried to find the positive examples. I mentioned that it was Lviv, Odessa. We have Lemishka Boris and Ludmila Antipova who may answer this question, why it was not very successful. In other regions, although the briefing is approaching to the end, I would like to invite the experts, the chief managers, chief healthcare managers. I invite you to the microphone and please answer this question and describe your results very briefly. Good afternoon. I'm chief expert in family medicine development in Lviv City State Administration. I'm chief medical doctor in the family clinic, and back in 2004 we have created our primary medical center in the local clinic. The major principle was to define the tariff for healthcare services and differentiation of medical budget and allocation of the budget in line with the delivery of the services in line with the tariffs. This allowed us to have monthly control for efficiency of spending, then assessment of the quality based on ratings. We assessed quantity and quality of delivered services. We analyzed primary and secondary visits and experts, and we managed to provide special bonuses for those doctors who provided better services. So what became better in services deliverers? Actually, the patient's opinion could be the best indicator of quality, and I believe that our objective data are better than average in the city. As for the access, we managed to make it better and get better opinion. As for the complaints of patients, the situation is also much better. Unfortunately, as of now, we cannot earn money legally. We should have we need to have is defined level and numbers of services to be delivered and money allocated for them, and then develop and offer some other services and earn money to cover the deficit of the state budget. Thank you very much for your answer. I would invite representative of the other region. Could you explain what became better for the patient and for the doctor? In example of Voznesensk, in a case of Voznesensk, everything is so clear. But please describe the changes in your city. Thank you very much for raising this topic. Shpak Yuri, Director of the Healthcare Department in Odessa City Council. I believe that suggested changes may positively influence passage of the draft laws in the Verkhovna Rada, because we expect to have serious collapse in the healthcare area nearest future without passage of the laws. When the pilot project on healthcare reform was launched in pilot regions in 2012, I immediately met with our medical workers. I met with 16,000 medical personnel, and I promised them that it won't be worse, it will be better in result of reforming. I promised that upgrading of neuro specialists to family doctors would be beneficial for them personally and for people in general. And those changes which I promised them, what did I promise? That salaries will become higher, that would become higher, that we would improve labor conditions. We promised that salaries would depend on the quality and quantity of services, and later we had to I was forced to say to the patients that it will be better in future, please do not go to the specialist. And now chief doctors in the hospitals, they are ready to go back because the routes for the patients were not defined clearly. So without official regulation which would allow us to go out from the shadow and move forward, we will go 15 years backward. We try to introduce partial insurance. We have 5 methodologies how to calculate insurance, which are now posted on the Ministry of Healthcare website. They are imperfect, and
if you can answer my question, I can say a few words, right? And then you can continue your communication with those willing. If we are talking this operation did not bring any fruit, we do not have anything to motivate the people. The salary hasn't been increased. Yes, the conditions have been improved. We repaired 32 buildings over this year, and we opened some new children's outpatient clinic, too, etc. It's the only city in Ukraine where free of charge for the citizens by the expense of the city budget they pay with such as the MRI our services without waiting for any relatives in the private computer center. They provide this MRI services, but the budget pays for this service. I'm sorry, okay. Please be, we are talking about just computer tomography and MRI. You know, today we introduce the procurement of the purchase of services based on diagnostics and treatment. The acute coronary syndrome and the myocardial infarction, MI. All those elements are available, but again, my request to the central executive authorities which have to take care of that, there must be some social, let's say, request for this, for the register of the patients, register of the medical officers in the computer system, which will be based on the approved classificators, the cost of the services. Then we can move to forward without waiting for the adoption of the draft laws. Thank you very much. Well, this briefing is over, and the next one we are going to start in 20 minutes from now.
в общем, все плохо. Ни одного